Hello everybody. I will introduce very shortly at the beginning the AQH Project, the Swiss Development and Cooperation, one of the two Swiss projects in Kosovo, in health sector, and with only 2 slides, I would like to introduce the first project, AQH, which is a project in primary healthcare and tries to contribute to the improvement of the health status of the population of Kosovo, and how the project plans to do that, and planned for the last 7-8 years. It was with strengthen healthcare providers and managers able to meet the need of the patients, especially of the vulnerable groups, who are more aware of their rights and needs. And the overall project approach is actually expressed in the image through the 3 main directions of works, the project outcomes, and the synergies between these 3 directions of work. The project logic starts with support offered to the population and to the vulnerable groups in order to improve their health literacy level and to improve the knowledge and skills about their own health condition. And in order to give more information to the population, that the population is also able to better access the high quality of care. So it starts from there, it starts from the community, it starts from the patient's needs, and based on the assessments and the planning, then the project proposes and proposed several interventions at the level of the management in primary healthcare, being at the national level or at the municipality level, but also proposed and implemented in a number of municipalities interventions that are deployed to the community, to the services, to the beneficiaries of the services, to the primary healthcare providers and to the primary healthcare facilities, which deliver now quality services for non-communicable diseases to those informed citizens. And the whole philosophy in the diagram is that it goes and goes, continuing this cycle and coming back to the patients and measure the impact at that level. So accessible quality healthcare in primary healthcare tries to, again, to improve the health status of the population of Kosovo. And to have an idea about the scale of the implementation, here we see on the map the number of the group of municipalities that have been participating in the project up to now. The project had 2 phases already, and it started back in 2016 with 12 project partner municipalities. It's the first group that we can see there, and a group of 8 new municipalities have been added to the project area of interventions in 2020. It covers, with this coverage, the project covers around half of the primary healthcare providers in Kosovo and half of the primary healthcare institutions in Kosovo. And worthwhile to mention that primary healthcare in Kosovo is decentralized and administered on a daily basis by the local authorities. So in each of these municipalities, we can find the main family medicine center, which is the main healthcare institution in primary healthcare, surrounded by a number of family medicine centers and family medicine ambulances. So in each of these municipalities, primary healthcare is represented by a network of facilities. Yes, the project puts a lot of emphasis on this concept of patient at the center of primary healthcare service provision. And the way the project supported patients to become more and more in the center and more active includes some new processes and new structures, such as the patient councils, which we heard about it during these days, about the complaints management processes, and also the community scorecards, also discussed very much over the last days here. I would mention that there was a satellite workshop on Monday Tuesday satellite workshop for the conference that deals with patients' rights and patient responsibilities. These tools have been discussed there. Complaints management is already adopted not only at the national level through the specific dedicated phone number where patients can address at any time their complaints to at the national level, complaints about the health sector, about the quality of services they receive, but also complaints management means in primary healthcare that the main family medicine center, they have a way of collecting these complaints within complaints boxes, and also there is a process of managing these complaints at that level as well. All three mechanisms are embedded in primary healthcare facilities in main family medicine centers within the project partner municipalities as patient feedback mechanisms. This is one intervention that we strongly believe puts the patient at the center, because the patient become more and more active and takes up the role, an active role within the delivery of the services. Because through these mechanisms, patients can contribute and they can influence the quality of services which is provided. For instance, the first picture here on the slide is, on top of it is one of the sessions of community scorecards. Community scorecards means that patients and healthcare providers, they meet and discuss the quality issues they might identify. But they discuss that in a more relaxed environment. So this is a session of discussions which is coordinated, moderated by NGOs representing those communities in those municipalities. And there, healthcare providers and patients, they discuss more open. Yeah? It's obviously to hear. The discussion doesn't take place in the cabinet or in the main family medicine center. There are quite nice conclusions of these processes of community scorecards. I will not enter the details here. Yes, the second group of interventions, it's directly targeting the health literacy and health-seeking behavior of the patients through different activities. National health education campaigns, national health promotion campaigns, implemented at national level through TV channels and through social media. So many of these campaigns have been implemented over the last years, and they are all about sending messages to the population, to the vulnerable groups included, sending messages about how to behave in a more healthier way. Yeah? We've been listening a lot about the risk factors. Those campaigns are tackling the risk factors for NCDs. And what is a nice result about these campaigns, they have been evaluated. And at the end of it, it resulted that the level of knowledge within the population increased. So population knows more about NCDs and the risk factors. Community awareness sessions and health caravans. Second picture on the screen from one health caravan. They are going deeper. They are providing more detailed information about the risk factors at the community level. These two activities happen at the community level, together with the patients, together with the representatives of the patients, with the healthcare providers. What is also interesting, the healthcare providers being present in the health caravans and the health community awareness sessions, is that they identify cases. So yes, again, chronic conditions are underdiagnosed. It's obvious, they're everywhere, especially and including here in Kosovo. These health caravans and health community awareness sessions, through these activities, healthcare providers, they identify new cases and they refer these cases to the main family medicine center for future further analysis and tests, and then eventually diagnose the chronic patients, the chronic conditions. The last group of activities is about specifically about the patient rights and responsibilities. National campaigns, training sessions for patient groups, but also for healthcare providers have been supported with the project in project partner municipalities, and now the patients are more enabled about their rights and responsibilities, and they know more about what is expected from their side to contribute to the improvement of their own healthcare condition, of their own health condition. Okay, how can we benefit of this strengthened role of the patients as a system, and how can we answer the increasing demand? Because it is obvious, yeah, more enabled patients, they will demand for more services and for better quality services. That point has also been mentioned by previous speakers today and yesterday. But part of the answer to this question stays in the implementation of the WHO classic model of tackling NCDs within limited resources environments. And the project, the AQH project, dealt with this over the last years and adapted this model to the local context and to the local possibilities, to the available resources, and so on. So everybody knows the diagram of the WHO model for NCDs interventions. I will just explain a little bit what is in practical means the implementation of this model. So the situation has been assessed initially through a rapid assessment tool, and then the weaknesses have been identified, and then training plans have been developed. Also, intervention has been adapted to the local context that was assessed through these activities. Then, in order to improve the equipment basis at the primary healthcare, the sets of basic equipment have been procured within the project partner municipalities, and also infrastructure rehabilitation have taken place, and some health education corners have been established within the main family medicine centers and family medicine centers in project partner municipalities. Support managerial capacities to managerial capacity development and improve logistics. Also, there was patient passports, patient registries developed. I have the materials here, we will see it in the picture as well on the screen. They've been designed and implemented in order to support data monitoring and the health information flows coordinated by the Ministry of Health and the National Institute of Public Health. Of course, the basic tools of the WHO model, the protocols and risk charts have been translated, adapted a little bit to local context, and disseminated to main family medicine centers. Development of national clinical practice guidelines, and clinical protocols have been supported also to the project activities. Training for clinicians and nurses. This is quite a consistent component of the project support to project partner municipalities. This training packages addressed not only the implementation of the PEN protocols, but also the communication between health staff and patients, infection prevention and control, elderly care, and there is a specific module that is dedicated to motivational interviewing, motivational counseling services, which is pretty new and implemented in the field by the nurses in primary healthcare. I will just skip this one. And this is the way that the materials developed through the project activities look. We have, for instance, an individual plan, patient individual plan of care. On the left side is the well-known WHO package of essential services, essential interventions for non-communicable diseases. Then the risk chart, the table where the data is collected at the main family medicine center and then reported to the national institutions. We have a patient passport in the picture here on the right, which is patient libretta, which is used by the patient on daily basis, the chronic patient. And yes, to describe a little bit the flow that a chronic patient ideally follows within the primary healthcare in project partner municipalities. So it's starting with the establishment of the target groups, which is men and women 40 years or older, being at risk of chronic condition, and also the focus is on vulnerable groups like Rai, Roma, Ashkali, Egyptian communities here in Kosovo, women and also elderly. It starts from there. These groups are already equipped with some knowledge, with some information to the health education, health promotion activities. The flow follows there. So the patient comes to healthcare providers, to the healthcare facilities in primary healthcare, and then they are consulted by trained clinicians, by the trained doctors. And then we have two scenarios. If the situation is that the diagnosis is already placed, then it continued with the provision of treatment and the therapy and everything. And the other scenario is that that citizen, that patient or that client, let's say, is not necessarily diagnosed but is still at risk of chronic condition. Then in both scenarios, they are referred by the clinician to the nurse. That nurse that is trained in motivational counseling, motivational interviewing, is trained to give health promotion services and to prevent through this intervention the aggravation or getting sick of chronic conditions. This flow follows with what the health educator, the nurses at the what we call health resource centers in main family medicine center do. So they perform one-to-one or group sessions, and they also provide information materials, and they refer back whenever is necessary to the doctor as per the protocol specifies. And then the health educator, of course, the nurse at the health resource centers make use of the guide and all supporting materials they have, discuss with the patient the risk factors, and establishes together with the patient an individual care plan. This individual care plan is followed for a longer period of time, as much as needed, and it includes for a specific group of patients, which is diabetes type 2 patients, 65 plus. It includes also an approach with an integrated care of health and social services. Out of time, yes. Definitely the shortest presentation. Last slide, and there is also a video of 2 minutes. I, for purpose, left the video at the end of the presentation to be shorter. So there are also plans for the future, and SDC, the Swiss Development Corporation, decided already to continue support intervention in primary healthcare for chronic patients with a third phase of the project. And within this third phase of the project, we will also focus a lot on horizontal dissemination. What is the meaning of horizontal dissemination is that capacities in project partner municipalities will be supported, will be rolled out, at the horizontal level. I mean, extending capacities from main family medicine centers to family medicine centers in primary healthcare, scale up to non-project partner municipalities. So the approach will be that all the municipalities in Kosovo will have the opportunity to implement project-supported interventions in the future, and also the focus on transfer of the process ownership to national and local stakeholders. With those being said, I will just move to the video. There is 2 minutes.